Like HFpEF is not all that complicated to actually figure out. So you need signs and symptoms of volume overload. And that can be evidenced by elevated natriuretic peptides or objective evidence of cardiogenic or systemic congestion. So it's one of those things where I feel like, when you see it, there are other things that we'll talk about as we go through in terms of biomarkers and risk calculators and that kind of stuff. But the big takeaway is that if someone has preserved ejection fraction, seems volume overloaded, they're most of the way to the diagnosis. But I have a feeling that's not specifically what you're asking me.
Yeah, I mean, what I was getting at a little bit is the sort of a little bit of the company it keeps, right? So like if they have edema and shortness of breath, and then they also have diabetes, obesity, CKD, high blood pressure, AFib, those sort of things, that's somebody that you're going to be suspicious they could have heart failure with preserved ejection fraction, especially if like you get the echo and the EF is preserved. That's something that's going to be on your differential. We asked her about using the BNP levels. She's not really a fan of the BNP. There are some tricks to interpreting it because she mentioned that there's actually increased clearance in the adipose tissue. So people with obesity and also insulin resistance also messes things up a little bit. So it actually like lowers the BNP.